I am here today to report 3 new cases of COVID-19 in Prince Edward Island. This is disappointing news, but we have said consistently that we need to be prepared for more cases, and we are. None of these 3 cases are related to seasonal residents or the opening of the Atlantic bubble. One case is a male in his 50s who is an essential worker who recently traveled outside the region. He has self-isolated since returning to the province and is at home. The other 2 cases are individuals in their 20s. We believe that these 2 cases are connected, and one case is related to travel to Nova Scotia where he had contact with someone from the United States. He is asymptomatic. The other case, a female, is symptomatic and is a close contact of the male. She works at Whisperwood Villa and recently worked at the home. She did wear appropriate PPE while working and does not provide direct personal care to residents. She left work as soon as she was not feeling well. We made initial contact with the management at Whisperwood Villa late last evening as soon as we became aware of the positive case. As a precaution, steps are being taken to test all residents and staff of the Whisperwood Villa beginning this afternoon. Staff will be contacted individually regarding the process to get tested, and resident testing has already started. I've been told that none of the residents have any new symptoms of COVID-19. As an additional precaution, I'm also asking that anyone who visited Whisperwood Villa on Tuesday, June the 30th, be tested. Again, these individuals will be contacted directly regarding the process and timing to be tested. The lab has advised that test results will all be available within 24 hours. In addition, contact tracing of the cases through public health nursing has started. Early and comprehensive contact tracing is key to containing further spread of COVID-19 in our community. We are working together with Whisperwood Villa, and we know they have been diligent about following the guidance from our office since the pandemic began. We have been advised that all indoor and outdoor visits are canceled until further notice, and there will be no communal dining. The frequency of resident temperature checks will increase to twice a day, in addition to twice daily screenings. We are working with Whisperwood Villa to ensure they have the supply of personal protective equipment they need. While I believe the risk of spread is low at Whisperwood, given the staff member wore appropriate PPE and did not provide direct care to residents, our top priority is to prevent further spread of COVID-19 to residents and staff of Whisperwood Villa and in the community. The safety of our residents, our staff, and islanders is our primary concern. We are contacting individuals who need to be tested, staff of Whisperwood, and visitors to the home on Tuesday, June the 30th. We are working collaboratively to take all steps necessary to mitigate any spread of COVID-19 in the facility and keep residents and staff safe. Community paramedics from EMS have been deployed to Whisperwood Villa to assist staff with resident testing. The QEH has been notified of the situation at Whisperwood Villa and are preparing to receive ill residents if needed. In preparation for an outbreak of COVID-19, staff at all long-term care facilities, including Whisperwood Villa, received training in infection prevention control and steps to minimize transmission among residents. I understand this news is very concerning for residents and staff, their families and loved ones. Whisperwood Villa is in the process of contacting families, and information will continue to be directly shared with families and loved ones as it becomes available. We are still experiencing a global pandemic, and we did anticipate new cases of COVID-19. We are ready to deal with this situation, and are confident in our capacity to respond to this outbreak in terms of testing, contact tracing, and self-isolation. We know from experience in other provinces that contact tracing within the first 24 to 48 hours has made a significant impact in the containment of the spread of COVID-19. The situation is a clear reminder of how important our messages have been. Keep your circle of contacts small. Physical distance, social distance, stay 6 feet apart. And if you cannot physically distance, wear a non-surgical mask is being recommended. Wash your hands frequently. Do not go to work if you are feeling ill. And if you have symptoms of COVID-19, call 811 to arrange to be tested. We have strong public health measures and protocols in place. However, they will only be effective if they are followed. COVID-19 has not gone away, and each of us has a responsibility to keep each other safe as we learn to live with the pandemic.
Hi, Dr. Morrison. Just wondering what the impact this might have on the newly formed Atlantic bubble with 3 new cases now in the province.
You
want me to start?
Sure.
As Dr. Morrison indicated in her introductory remarks, Travis, that as of right now, nothing has changed in terms of the Atlantic bubble. The 3 cases outlined, the 3 positives are not connected to the Atlantic bubble, but at the same time, we have been following public health directives and following the epidemiology. So I think Dr. Morrison and I talked earlier this morning, and we will take the next 24 to 48 hours to allow the contact tracing and the Chief Public Health Office to do what they are prepared to do. And we will let the information guide us at that time. We've said from the very beginning, if we need to pull back, we would. And if the public health information and the epidemiology points in that direction, then we would be prepared to make a decision on pulling back early next week if that's where the information points to.